Hi everybody, thanks for downloading this video. This is meant to just be a quick introduction to the nuts and bolts of how a Balint group works so that you can know what you're walking into when you join our group. So thank you again for joining us, and I hope that you continue to participate in our group. So Balint is a group process that we have borrowed from human medicine and adapted to veterinary medicine. So the Balint structure in human medicine is based on a structured group exploration of the provider-patient relationship. In our case, it's a little more complex than that because the relationship that we're exploring is the provider-client patient relationship. So our relationship with the client can have added complications from the client's relationship with their pet. So the way that this works is that a thorny case is handed over from one individual to the group. And the group then takes that case from the individual and they start to work that case. And what they do is to try to examine the relationship from three different focuses. And that's the patient perspective, the provider perspective, and the relationship between the two. And in our case, we're including the client in the patient perspective. The ground rules for Balint are that we have mutual respect and absolute confidentiality in the group. So what that means is that what we say in Balint stays in Balint. Sometimes some upsetting themes or things that stick with you that you just really feel like you need to talk with someone about might come up. And if you do that, we just ask that you strip away any kind of identifying information where someone might be exposed as a member of the group or the patient could be exposed in any way. So when we talk about respect, we're talking about having respect in the way that you talk to each other, giving space for people who are slower to talk to have the time to speak up and share their views. But we're also talking about respect from the perspective of giving enough respect to the presenter of a case that if there were an easy solution, they would have already thought of that solution. These are cases that they've been stewing over for some time. And if there was an easy fix, they would have already arrived at it. And so out of that respect comes the rule of no advice giving. We're not trying to solve a problem in any way. We're just trying to explore a problem and really try to multiply the possibilities that are within that relationship that we're exploring. So these slides are from the American Balint Society that go through a little bit of the mechanics of Balint Group. So as I mentioned, there are some ground rules of confidentiality, respect, ownership of what you say, and avoid advice giving or anecdote sharing. So the way that the group is structured, if this were to be an in-person group, we would have a circle of participants with two co-leaders. And we'll have that same sort of structure virtually, where we'll have a group of participants as well as co-leaders who help to guide the group towards examining those three perspectives that we talked about. So in order to start a group, one of the leaders will call for a case. So we'll just ask for a case from the group. And the natural question is, what is a case? So a case is any kind of relationship or interaction that for some reason you feel unsettled with. Ideally, this is a client that you have an ongoing relationship with, but it's still worthwhile to examine even those abbreviated relationships in an emergency setting. The presentations are spontaneous. We're not looking for any kind of prepared data. The medical aspect of the case is really the least important part of this. So when we present a case, we're really dwelling on the relationship and the dynamic rather than specifics like kidney function or respiratory rate. So these are patients who we feel conflicted about or who we feel strongly about. Patients that just leave us feeling like we're not done with our job or who we're losing sleep over. Or if you're sitting in group and as you're sitting there, a patient just kind of bubbles to your consciousness. They bubbled up to your consciousness for a reason, and that usually means that they're a great case to explore. So we have a volunteer who presents a case, and that person presents very abbreviated medical information, um, which includes some information about the person who's in front of them. So, for instance, they may say, Angel is a 14-year-old Maltese with congestive heart failure who belongs to an elderly woman named June, who I have been seeing for the past 10 years. And to give a little bit of context so that people can understand how you've arrived at the current state. And once the presenter has concluded their presentation, which is generally fairly brief, we then ask for any clarifying questions. And the clarifying questions are meant to be informational questions. So they're not meant to be an opportunity to solve the medical problem or explore the medical problem. They're not an opportunity to start working the case and start thinking of possibilities. Really, they're simple things such as, does June live alone or does June have a partner? Um, is her pet, has her pet been with her for her entire life, or is this a new adoption? Things like that, as opposed to more in-depth, complex questions. And then we actually invite the presenter to push back. So in person, oftentimes we'll have them literally push back their chair so that they can relax and listen. In this virtual setup, what we're going to do is just let the presenter figuratively step back. They can actually mute themselves and just listen while we start to work the case. And then the group starts working. And what that work is trying to take an imaginative approach to what's going on in this relationship. So a lot of times it starts with I statements. And, you might say, oh, I imagine Angel's family to be very sad about this diagnosis. So we try to explore the perspective of both the client and the provider. So that imaginative process ping-pongs around from all of the different perspectives that are represented in this relationship. And metaphors, images that pop into your mind are absolutely fair game. Even if they might not make complete sense, they can still be a really rich area for us to have a jumping off point to talk about the case. So towards the end of the session, we invite the presenter to rejoin the group, and they can join in working the case, or they can simply continue to listen and gain the perspective as the rest of the group continues to work the case. So your role as a group member is to explore that clinician, client-patient relationship. So we ask that you look inward, be imaginative, be creative. We're looking at the exact opposite of the type of thinking that we have in our clinical lives on a daily basis. So where we're typically ruling out possibilities, this is really an opportunity for us to kind of exercise the muscle of thinking more broadly and expansively and being inclusive in all of the multiple different possibilities that we can entertain simultaneously. So we do ask that you differentiate your own experience from the presenters. If you had a similar situation and feel like you want to share your advice from your own experience, we ask that you take a moment to recognize that no one's experience is the same and to really honor that presenter's experience as a separate entity. So anecdotes and advice from your own past don't really have a place in Balint. Instead, we ask you to treat every situation as fresh and new. So this group is hopefully going to provide for you a safe place to have emotional reflection on troubling cases. For the presenter, it can give them the opportunity to see different understandings about a case they're struggling with in a very practical way. But the group can benefit in the exact same way, where they learn to entertain different perspectives and think a little bit more broadly about their interactions with clients. It allows us to uncover our blind spots, the baggage we carry into every exam room. We get to unpack a little bit in this group. At the same time, we get to enjoy our shared experience. We're all passionate about what we do, but what we do comes with a heavy emotional load. So it's really helpful to understand that everyone's in the same boat and that we can actually act as not only a support, but as a way to learn from each other's perspectives. So overall, this is meant to be a group that allows you to grow and develop. But what we find in our participants is that everybody walks out of the room, figuratively or literally, feeling a little bit lighter. So this sounds like we're dealing with really heavy stuff, but I think most of our participants would say that it's really enjoyable work. So thank you again for listening, and I look forward to seeing you in our group.